Hi, I'm Dr. Danny Clark. I'm the new Director of Orthobiologics here at the Protea Performance Center. I want to talk about nerve hydrodissections today. This is probably one of my most favorite procedures based on how well it can work both in the immediate term and long term. So, a nerve hydrodissection is the use case for this is someone who maybe has carpal tunnel syndrome. So, traditional options for carpal tunnel, usually it's just kind of rest, ice, take anti-inflammatories. If that doesn't get better, then maybe they will do a carpal tunnel release where they essentially take the ligament that goes over your wrist here and they cut that ligament underneath that holds those tendons and nerve together. And what that does is it creates more space for the nerve, which can be effective, but scar tissue can form. That there's other complications that can happen with these procedures. Anytime we do surgery, there's always, a risk associated with that. I choose to do what are called nerve hydrodissections for something like carpal tunnel, where under ultrasound guidance, what we can do is we can very precisely guide a needle right into that carpal tunnel area around the median nerve that would be causing some of that numbness, tingling, weakness in the hand, and we inject a fluid. So in this case, we'll say we're injecting PRP, which is platelet-rich plasma. What we do is we inject around that nerve to separate that nerve away from the surrounding tissues, away from that ligament, away from the other tendons that are around it in that little tight kind of canal where that nerve is running. This does two things. One is it mechanically separates that nerve from the tissues around it where, maybe there's some adhesions from some inflammation. So it's kind of stuck to those tendons, stuck to that ligament, and that's furthering the irritation of the nerve. Then it's the injection of the solution that we're using is also really important for this healing process, where it's going to also reduce the inflammation around that nerve, help that nerve heal, give it the growth factors it needs to heal. So again, there's the two different ways it helps. It's mechanically separating, creating more space for that nerve to move and glide and, live in a little place in a little bubble that it likes. But it also helps to reduce the swelling of that nerve so that that nerve itself is smaller and thus has more room to move. And so if you leave it alone, it's irritated, gets inflamed, gets larger, and then more inflammatory crap kind of builds up around it. And so that vicious cycle continues, and our goal is to stop that vicious cycle, improving the room it has to move, but also just improving the health and the inflammation of that nerve itself. Nerve hydrodissections can really be applied anywhere in the body, any peripheral nerve. Some common places that we'll see it or use it as an effective treatment is cubital tunnel. So if there's some nerve entrapment in the elbow region around here, sometimes people have nerve entrapments around like their foot or around their knee. That's a really common one. There's a really specific nerve on the inside of the knees called the infrapatellar branch of the saphenous nerve. Super long word, but ultimately it's a small little cutaneous branch or a branch of nerve that goes to the skin around the medial side of the knee. This oftentimes with patients that have injuries to maybe their MCL, their meniscus, they have really bad arthritis in their knee that's generating a lot of inflammation. That inflammation in those tissues or structures nearby can irritate the nerves over top of them. And so what we see is we can treat those other things all day long, but sometimes that nerve is also involved in the pain pattern. And so hydrodissecting those nerves away from the tissue surrounding that inflamed tissue, providing some nutrients and growth factors to those nerves, helps in that complex or that comprehensive treatment to the structures that we're trying to get to heal. If this sounds like something that you've been dealing with, maybe you've had treatments of certain joints like your knee, and it's not getting better and there still seems to be some lingering pain, it could be a nerve related issue that's not being addressed. And so again, if this sounds like you, feel free to reach out to the office. We can schedule a free 15-minute discovery call, chat about your case, see if you'd be a fit, and see if I'd be able to help.